We live in interesting times for the headlines.
I think so, huh? All right, thank
President
you all.
Trump signs into law the $2 trillion rescue plan to salvage a U.S. economy crippled by the coronavirus. On a day, the nation sees a record 18,000 new confirmed cases of infection. The Chinese city of 11 million people that was ground zero for what became the global coronavirus pandemic partly reopens after more than 2 months of almost total isolation. And we will be bringing you updates from our EBC correspondents around the world and their coronavirus situation. We have our correspondents from Japan, from United Kingdom, Alberta, Canada, the Netherlands, Australia, Vietnam, Qatar, and many more. I'm Alma Angeles, wherever you're watching from around the world. Thank you very much for joining us and after the news. A mammoth pandemic plan for the U.S. costing more than $2 trillion is now law. President Trump had already signed it, and he ordered a major automaker to start building ventilators. He also authorized calling up military and active National Guard reserves to duty. Now that came as U.S. infections topped 100,000, the most anywhere in the world, with more than 1,500 deaths. But there's also a need for medical support. Take a look.
This is the really bad news. The number of deaths is increasing. It's bad news because people are dying. And that's the worst news you can have. It is not bad news in terms of it being unexpected. I was shocked that they were so irresponsible in addressing the state and the city need. I mean, I never believed that they would just pass a piece of legislation that didn't address it. You know, they just did not address the revenue shortfall. Stimulus bill helped unemployment insurance, and that is a good thing. It helped small businesses, and that is a good thing. It did not help local governments or state governments, and it did not address the governmental loss. And the federal officials, the ones who are being honest, will admit that.
Meanwhile, this U.S. Navy ship will be dispatched to New York this weekend, and her sister ship, the Mercy, entered the port of Los Angeles. It'll take in non-COVID-19 patients to ease the burden of crowded hospitals in the U.S. Meanwhile, U.S. President Donald Trump invoked the Defense Production Act to require General Motors to begin producing critically needed ventilators. Take a look.
This afternoon, I invoked the Defense Production Act to compel General Motors to accept, perform, and prioritize federal contracts for ventilators. Ventilators are a big deal, and we've delivered thousands of them, and oftentimes you don't need ventilators very much. Hospitals don't have very many, and now we're turning out that we have to produce large numbers, but we've been able to do that, and we're going to be doing a lot more.
The act, designed for use in wartime to commandeer private business to manufacture for defense needs, will now allow the White House to require that GM, quote, accept, perform, and prioritize federal contracts for ventilators. This was in a statement by President Trump. And around the world, communities are finding ways to cope with rising infections and overtaxed medical systems. Hospitals and retirement homes in Bergamo, Italy, the epicenter of that nation's crisis, opened their doors to Russian military medics as the death toll reaches 9,000. Italy's infection rate has slowed, but the number of deaths account for more than a third of the world total. And Prime Minister Boris Johnson has revealed he is now infected. Let's take a listen.
Hi folks, I want to bring you up to speed with something that's happening today, which is that I've developed mild symptoms of the coronavirus, that's to say a temperature and a persistent cough. And on the advice of the chief medical officer, I've taken a test that has come out positive. So I am working from home, I'm self-isolating, and that's entirely the right thing to do. But be in no doubt that I can continue, thanks to the wizardry of modern technology, to communicate with all my top team to lead the national fight back against coronavirus. And I want to thank everybody who's involved. I want to thank, of course, above all, our amazing NHS staff. It was very moving to join in that national clap for the NHS.
Meanwhile, other parts of the world are still hoping to avoid the worst. In Johannesburg, South Africa, the police and the military patrolled the streets, ordering the people home. The country reported its first coronavirus deaths today and began a 3-week lockdown. And at the other end of the tunnel, the Chinese city of 11 million people that was ground zero for what became the global coronavirus pandemic partly reopened Saturday after more than 2 months of almost total isolation.
感觉有点像回到了异国他乡的感觉，因为毕竟2个多月没有回来了，所以还是挺想再看一看。我想经过这一次这个肺炎疫情之后，也许武汉人会比以前更团结。
Wuhan was placed under lockdown in January with residents forbidden to leave. Roadblocks installed and millions subjected to dramatic restrictions on their daily life. But the central Chinese city has now reopened its doors, at least partially. People are now allowed to enter but not leave, and many trains arriving Saturday had been fully booked days in advance. Restrictions on residents heading out of Wuhan will not be lifted until April 8. The major transport and industrial hub is the last area of Hubei province to see travel restrictions lifted. With the exception of Wuhan, railway stations and airports began resuming operations across the province earlier this week. Eagle News will be right back.
When visiting the Philippines, Manila or Quezon City is a popular destination. But oftentimes the hustle and bustle of the city can be more stressful on your vacation. So when you feel the need to reconnect to nature or relax again, there's a beautiful oasis just outside of the city called the Garden at Ciudad de Victoria. Some of the species that you can see here include hydrangea, snapdragon, and stargazers. They're truly beautiful. The gardens at Ciudad de Victoria are so peaceful, tranquil, and beautiful that it's become a haven for young couples and a very popular venue for engagement photos. The next time you want an escape from the big city, the garden at Ciudad de Victoria is a wonderful place to visit.
All right, welcome back. And we are joined live by our EBC Bureau in Qatar. Abigail Basa will give us an update in the coronavirus situation over there in Qatar. Hello, Abby. How are you?
Good evening po, Ms. Alma. Good evening to
Hi.
everyone from Qatar.
So, what are the updates over there in Qatar? Can you give us the updates over there?
As of today, there are 562 cases. The tested are 14,345. 43 have recovered, and the deaths so far is 0. As for the stimulus package for the economy, country have loaded 75 billion Qatari riyals economic and financial stimulus package that was part of a series of directives by His Highness the Emir Sheikh Tamim bin Hamad Al Thani to support and sustain the country during the COVID-19 pandemic. Experts say that the Qatar Central Bank's directives to protect the country's private sector, it is to help take over the payrolls of some really struggling companies so the workers don't get laid off. The government's timely intervention, many companies would be able to exit their frozen status immediately. And under the stimulus package, the priority sectors are the aviation, the hospitality, and food and transportation sectors. Qatar Chamber also launched Takatuf. This is an initiative that urges its members, as well as public and private joint stock companies and businessmen, to support the country's efforts to prevent the spread of the novel coronavirus. So the initiative aims to mitigate the economic impacts of the precautionary measures taken by the country by providing in-kind support as a contribution to provide governmental needs required for these measures. So far, the measures seen in the country, the health and public measures are, we have been seeing the spokesperson for the Supreme Committee for Crisis Management, Her Excellency Lolwa bin Rashid bin Mohammed Al Qatar. She holds a press conference every evening to update the public. And the Ministry of Public Health has a COVID-19 surveillance unit team based at the ministry, and they have been continuously monitoring the epidemiological situation since the outbreak of COVID-19 in China. The unit is working to proactively identify people in Qatar who may have been in contact with confirmed cases. So they constantly monitor also the airport activities. Once they identify these people, they are placed under quarantine to prevent possible further spread. WHO also praised Qatar's measures to battle COVID-19 by Director General Dr. Tedros Adhanom Ghebreyesus. In a tweet, he said that he had a good call with Her Excellency the Minister of Public Health, Dr. Hanan Mohammed Al Kuwari, and he congratulated her for the Emir's leadership to contain the novel coronavirus. The website also released early information on the symptoms how to do home quarantine because the public is discouraged to crowd the hospitals and health centers. They can call 16000 for any questions about COVID-19. And so far, the newest update po, the country called volunteers that has had a response of over 35,000 of volunteers, and they are now looking at temporary facilities with 18,000 beds ready, announced to be ready in weeks. And this is to be a quarantine area with a clinic. And the Ministry of Commerce and Industry signed contracts this week with 14 companies to raise the strategic stock of food and consumer goods in the country. And so far, the keeping the social distancing have been mandatory. It has been implemented in supermarket stores, and supermarkets also have their people wiping all the grocery carts with sanitizers, and they're giving out gloves and masks po. And so far, that's it po.
Okay. So, Abby, kumusta naman sa mga groceries? Do you have enough supplies over there? Okay naman
Yes
kayo?
po. So Qatar have been self-sufficient po since 2017. They have been producing local produce and products, and they even have there's news even that they will have a factory for sanitizers and masks ready, I think, in a month. Apo.
And another big news coming out of Qatar is also the World Cup, no? How is that going?
It's true. Yes po. So far, because there are so many facilities po that were planned and underway. So the construction it was supposed to be done actually. Some of them at the end of the year to be ready for usage for next year. So the measures they have taken, so the government have been visiting the sites, the construction sites, and they've been educating the workers. So the construction is still ongoing for now. But I believe they've been giving out free gloves and masks and hand sanitizers to the construction companies for the workers. And I believe they have already sanitized 202 labor accommodations. And they're still inspecting the other places po.
What about our OFWs there? Kumusta naman po sila? How are they?
They're okay po. So they like Philippines, for some are just in.
Okay, I lost her there. All right, we lost connection. Thank you, Abby Basa, reporting from our EBC Qatar Bureau. Okay, let's head on over to Vietnam. Their fight against the coronavirus has won praise due to its low-cost model. And we have more news from Vietnam. Joining us live is Chriselle Lacuna. Chriselle? All right, Chriselle, can you hear me? Hello, Chriselle. I can hear you.
Hi, Alma. Good evening.
Hi. Finally, Chriselle. Hello. How are you? So what is the news coming out of Vietnam?
Okay, let me read some news about in here in Vietnam. So thousands to be tested for COVID-19 after cases confirmed at major Hanoi hospital. Thousands of people are expected to be tested for the novel coronavirus disease after 2 nurses and a patient at a major hospital in Hanoi were recently infected. The Ministry of Health has tasked Loong Ngoc Kyu, head of the Medical Services Administration, with leading a special anti-epidemic team to cope with the COVID-19 situation at Bac Mai Hospital, located in Dong Da District, Hanoi. These were the first health workers in Vietnam to be diagnosed with COVID-19. Meanwhile, in Ho Chi Minh City, the Ho Chi Minh City administration is printing out 5 million leaflets, each containing to suppress the novel coronavirus disease epidemic, to be distributed to every household soon. So some of the contents of the leaflets, Alma: halt meetings and events attended by more than 20 people in a room, and do not assemble in groups of 10 people or more outside public offices, schools, and hospitals. Completely stop religious rituals and activities joined by 20 people or more, at places of worship and cease all cultural, sporting, and recreational events at public venues. Do not leave the house unless under truly necessary circumstances. People aged over 60 should absolutely stay at home. Wear face masks in public and at work. Do not be in contact with or interact with people who are not wearing face masks. And lastly, do not share or spread fake news. Another one good news about in Vietnam is that Vietnam wins phrase over COVID-19 combat for low-cost model and with limited resources. So Financial Times has published an article analyzing some positive aspects of the Vietnamese government in COVID-19 epidemic, especially the low-cost model, which focuses on quarantines and contact tracing. Most of Vietnam's 96 million citizens were celebrating the Tet Lunar New Year. Prime Minister Nguyen Xuan Phuc was at a government meeting declaring war on coronavirus. The disease was raging over the border in China, and Mr. Phuc warned it would soon reach Vietnam. So they've been telling the people that it would soon, by January or last January, they've been telling the people that it would soon reach Vietnam from China, as we have a border here in northern part of Hanoi. So he said, fighting the epidemic is fighting the enemy. Since then, Vietnam has proved a model in containing the disease in a country with limited resources but determined leadership. Rather than embark on mass testing, which has been the crux of earlier South Korea's response to the outbreak, Vietnam has focused on isolating infected people and tracking down their second and third-hand contacts. Vietnam is a mobilization society, said Carl Thayer, professor emeritus at the University of New South Wales, Canberra. It is a one-party state. It has large public security forces, the military and the party itself, and it's a top-down government that's good at responding to natural disasters. At the time when its neighbor Thailand is being criticized for its haphazard response to coronavirus, and Myanmar, which claimed to be free of the disease until reporting its first 2 cases on Monday, Vietnam's response has been praised by health officials. Kidong Park and the World Health Organization's representative in Hanoi lauded Vietnam for its proactiveness and consistency throughout the response. Alma?
Chriselle, no, it's now clear that we're all in this together, united, global citizens, and we all have a part to play in this coronavirus crisis. What can you do as our EBC correspondent there in Vietnam to help in this crisis?
Siguro po, as a Filipino living in Vietnam, what I can do is just to follow the orders of their government, and as well as our government back in our home country. And also always implement the precautionary measures, and always staying on alert and updated about this novel coronavirus disease.
All right, thank you very much, Chriselle. You keep fit, keep safe, stay safe. Thank you for your time. All right, we lost her again. Chriselle Lacuna reporting from our EBC Vietnam Bureau. Meanwhile, some airlines have made temporary changes to their summer schedules amid the coronavirus pandemic. Let's hear more from our EBC Japan Bureau, Dennis Liu. Dennis.
Some airline companies have already limited their flight schedule since March 27. This morning at Haneda Domestic Airport, as you see, this used to be jam-packed every day because busy Haneda Airport is also called as the Tokyo Airport. But due to the impact of the COVID-19, you can only see few people here. And while I'm on board the 737-800 plane, I saw some vacant seats. Meanwhile, here at Naha Airport in Okinawa, let me turn around 360 degrees to tell if it's crowded or not. Okinawa, as some of us know, is the southernmost prefecture of Japan. And yeah, a big land area here in this island is being used as a base for the Americans. Now, this US base is on a lockdown since yesterday to suppress the increase of those affected by the coronavirus. How do people here in Okinawa cope up in this time of crisis? Let's hear some residents talk about what they do on a daily basis.
So, bale, 2 weeks po pinastop yung school namin. Bale, tapos bumalik po siya kasi halos wala naman pong case dito. Pero nung pagbalik po, almost spring vacation. So, bale, April 7 po ulit yung pasok.
Para sa akin po, ang naging malaking epekto ng pagkakaroon ng COVID-19, most especially po sa pag-aaral, na naka-apekto po ito. May times na kailangan pong i-stop ang pag-aaral, kailangan pong mag-stay na lang sa bahay at mag-study na lang on our own. And also, some of the people po, some of the students, they need to do studying online, which is hard po kasi you need to self-taught and there will be no teacher to teach you. What if you have questions? What if you don't understand what you're learning, but you can't ask question to your teacher because your teacher are not around? But ang naging good thing naman po na nangyari na parang sa kabila po ng mga kaguluhan dahil nga sa lumalagaan na sakit, dahil nga sa mabigat na karamdamang ito, parang nagtulong-tulong ang tao na walang mayaman, walang mahirap, na kahit anong kailangan ng kapwa-tao mo, i-provide mo, yung pinakikita ko sa online, na lahat nag-share, lahat nagkakaisa para sa ikabubuti ng bawat isa.
Alma?
Yes. Okay, so Dennis, that's how they were affected. But Dennis, no, yesterday I asked you, I'm still hearing that spring and cherry blossom hotspots are still being visited by by people over there. Is this true?
That's true, Alma. Actually, officials are urging citizens to stay indoors to prevent a potential emergency, but some were still carrying on as normal. Tokyo Governor Yuriko Koike has pleaded to the tens of millions of people in the capital and surrounding regions to avoid non-essential, non-urgent outings until April 12th. Alma.
Okay, so what about the famous Shibuya crossing? Is it still busy?
Oh.
Yeah.
Yeah, Shibuya crossing, right? I was watching TV earlier. On normal days, you could never see the street at Shibuya crossing because all you'll see is a stream of people.
Yeah.
But tonight at 7:30 p.m. from a private surveillance camera, you will see that it is almost empty. It feels like bringing back Tokyo 50 years ago, Alma.
Yeah. But I'm seeing the grocery now. Anyways, yes, the famous Shibuya crossing, it's always busy, I know. So now it's, there are still a lot of people. There were still some people, but you can't see it that.
Few people only,
Very
right?
few people,
And I have proven, right,
even cars,
that
yeah.
really, yes, Alma. I've proven that lesser people are on board the plane. So that's why they have canceled the flights due to the coronavirus.
Okay.
That's my update for now, Alma.
Thank you very much, Dennis. Thank you for your time. I know you're still working. Thank you so much for joining us. Keep fit, stay healthy. All right, thank you very much. Eagle News, we'll be right back. Stay tuned.
Mula noon hanggang ngayon, gabay natin ang MTRCB ratings sa matalino at responsableng panonood. Sa tamang pagsunod sa MTRCB ratings, ginagawa nating ligtas at makabuluhan ang panonood ng bawat miyembro ng pamilyang Pilipino. Lumipas man ang panahon, hanggang may pamilyang Pilipino, andyan ang MTRCB.
Welcome back. The governor of Osaka Prefecture asked residents to refrain from making non-essential outings this weekend. We have a report coming in from Lou Estefan Omelda from our Osaka, Japan Bureau. Lou, how are you?
Hi, good evening, Alma. We're doing great here. Now, for the updates, last night, March 27, the governor of Osaka asked all the citizens again to refrain from doing unnecessary and urgent outings this weekend due to the rise of the number of infected patients in the prefecture. In the past few days, there were only 7 to 8 new cases per day. But as of Friday, there were 17 new cases per day, coming down to that announcement they made last night. So as of early Friday morning, out of the 342 confirmed cases of novel coronavirus in the whole Kansai region, 156 of that are from Osaka and 120 in the neighboring prefecture Hyogo. And you know, the famous tourist spots in Kyoto, it's a very famous prefecture in the Kansai region. It already has 34 confirmed cases. So local leaders have also urged all residents who have just returned to the country from overseas to have self-quarantine. According to an article in the Japan Times posted yesterday, the Hyogo governor, Toshizo Ido, said, and I quote, "The situation in Kansai is not one where we have to immediately flip the switch for a lockdown of the cities, but we'll continue to monitor things," unquote. They also have mentioned that even though Tokyo and its neighboring prefectures have advised people to avoid going into the capital, nothing similar would be done in Osaka as of the moment. Kansai International Airport, which is situated in the boundary of Osaka and Wakayama, one of the gateways to Asia, has canceled 90% of its international flights. Well, on the brighter side, Alma, the supply of food and daily necessities are still abundant. Although there is still scarcity in alcohol and masks, these supplies are being replenished from time to time, and when they go out of stock. And we always notice people lining up as early as 8 in the morning before the stores, the drug stores open, so they can get a supply of these items. There are many other substitutes to alcohol as a disinfectant here in Japan. So you can also sanitize your items with different kinds of disinfectant, which is still very much available in the market as of now, Alma.
Mm-hmm. Okay, so we have a minute and a half. Train and train stations, are they still busy? Are they still crowded?
Yes.
Mm-hmm.
It's still considered crowded as of the moment because there are only very few companies who implemented the option for their employees to work from home. Mm-hmm. So we can still notice very crowded subways in the morning, in the rush hours.
Okay.
Yes.
What about cherry blossoms? Do you also have it there?
Yes, we do. I heard from a friend who lives near the Osaka Castle. It's a very famous cherry blossom spot, viewing spot. Mm-hmm. And there are still people doing the hanami, the cherry blossom viewing event. So I'm not sure. They're not that scared yet, I think. Actually, I heard, but you know, there's still, there's like a hotline available for everyone who wants to ask about, to consult about the coronavirus. And as of now, there are almost 40,000 people calling to get advice about the virus.
Wow.
Yes.
Okay. Thank you so much. We'll get more. Keep the updates coming, and we'll be calling you for more updates. Thank you. Stay healthy, Lou.
Yes, this is Lou Melda from Osaka, Japan. We live in interesting times.
Okay, we go over to the United Kingdom. The London mayor there, Mr. Sadiq Khan, has says the temporary mortuaries are going to be set up as he expects more fatalities from the coronavirus. But we have a report coming in. Joining us live is Jennifer Ringwood. Jennifer, how are you?
I'm fine, Elma. How are you?
I'm good.
It's good to see you again.
Good to see you. So what are the updates over there in London?
Oh, it's been quite a dramatic night. The cases jumped by 181 overnight. So they're already encouraging the police that they will use the new laws that have been passed to encourage. I believe they will also be able to fine people if they're found out where they shouldn't be. So far, the total of people that have died across the UK is 759 people. We have 1113,777 who have tested positive. But bear in mind, the testing here hasn't been that extensive, so it's hard to really know how many people have it. They are expecting what they're describing as a tsunami of cases to follow. So they are really trying to get a grip now and tighten the restrictions. I think yesterday we already spoke about our Prime Minister Boris Johnson. He was tested positive. He's currently experiencing mild symptoms. In the event that he is no longer fit or able to continue to lead the country from his home at number 10, his second is Minister of Finance. Hang on, sorry. Dominic Raab is the one that will be taking over from him. He's the Foreign Secretary, so he'll be the one who'll be taking over from him if he becomes too sick. And then in turn, Dominic Raab will be able to elect any one of his ministers to take over from him if the same thing happens to him. Also, interestingly, our health secretary has tested positive for coronavirus as well. But it does look like there will be more casualties among the government since they didn't break that long ago.
Now in the United Kingdom. So how are the UK hospitals coping with the outbreaks? Or with the outbreak?
It sounds like they're still struggling. I know that a lot of the masks are now coming through, so the PPE is already being delivered to many of the hospitals. Certainly we're hearing from different sources that they are arriving. But it is still quite a struggle because of the massive increase that has been happening. They have also announced that they will open 3 more hospitals. Now, we heard yesterday already that the Excel Centre in London, that is being converted to what will now be called the Nightingale Hospital. So there was 750,000 volunteers, I believe, very close to that number, who have signed up to help the NHS. And these are a mixture of people who are retired, people who are in similar professions, so perhaps dental nurses, veterinary surgery staff, those types of competencies that can actually be transferred to be able to help in the new hospital. I believe there are 12,000 dental practices across the UK, and the dentists there are being asked to volunteer so that they would be redeployed to be used in these new hospitals that are being made. So Manchester, Birmingham and Cardiff, I believe they would have hospitals being created there to cope with what they expect will happen. I think after the clap for all of the NHS staff, Boris mentions it in his interview there, it was emotional, and I think for the nation it was emotional. I don't think anybody didn't participate, except perhaps exhausted nurses themselves may not have joined in. But it was, I think, the emotional lift for them, and to feel that they are appreciated and that the I think the world now, we have our hats off and we are praying for them to be safe so that they will be able to continue to take care of us in this very, very difficult time. But I believe with the PPE coming in, the anxiety has become a lot less.
So, Prime Minister Boris Johnson, he thanked during his Twitter video, in his Twitter video, he thanked the NHS, the nurses and the frontliners. With this tsunami of patients, do you have enough health frontliners to tackle this?
If you'd asked me that a few days ago, I would have said no. But it does seem that they are really doing their very best to ensure that this is going to be dealt with. They are trying to establish 8,000 respirators and sourcing them from various different places. The company Dyson, subject to testing, that may well be a good source. Other industries as well are volunteering to make these. Again, they are looking at every possible way to ensure that we can cope with tsunami. As I said, new hospitals are being built. The Excel Centre, the Nightingale Hospital, that is well underway. And it looks like they are already fully staffing that through the army of volunteers that have come forward. I think that that number that they had been looking for has well exceeded their expectations. And it does appear that although we don't have like a final confirmation right now, it does appear that when it comes down to it, we will be ready. So I think in terms of most of us ordinary people sitting at home, we understand the need to make sure that we don't add to the pressure on the NHS, and we understand that we need to stay at home to try and ensure that they are not going to, we're not going to add to that pressure personally. They are also bringing out other things.
Okay. So I've also read that, Jennifer, that a new low-cost rapid COVID-19 test has just been developed. Do you have any updates on this? If not, you can come back to me with that.
Thank you. That's right. So it's an antigen test that they're actually trialing at the moment.
Okay.
Specifically, the first one, it's similar to the drive-through testing that's been done in other countries.
Okay.
And this is aimed at the healthcare workers directly, so that they can, if they are feeling well enough, they can have this antigen test. They can check if they are COVID positive to see if they have the antibodies in their system or not. Antigens to the virus in their blood. If they have them, then they know that either they are in the process of getting over the virus or they have had it already. So that's briefly what I understood for it. I hope I'm right. But that is specifically now being aimed at NHS workers so that they can be going back to work a lot sooner. They will receive their results the next day. There is another test being developed for the rest of us, but as yet it's the sourcing and supply. So they are now looking at how that can be done in a more efficient way. But again, all of the things that we are hearing at the moment, they're very positive, they're going in the right direction, and it does look like they are really putting the accelerator on and trying to get this done as quickly as possible.
All right. Thank you very much, Jennifer, for all that updates. Thank you so much. Keep fit, keep safe. Thank you for your time.
Thank you. Thank you, Alma. I'm Jennifer Ringwood. We live in interesting times.
Eagle News will be right back.
Net 25 available in the Middle East on OSN.
All right, Alberta ordered non-essential businesses to close. We have more from Kat Esperame, joining us live now from EBC Alberta, Canada. Hello, Kat.
Hello po, Alma. Good evening there and good morning from Canada.
Okay, so what are your updates for us now over there in Alberta?
For sure. So in terms of testing for COVID-19 here in the province of Alberta, as of March 27, 2020, 37,673 results came out negative and 542 results came out positive. Therefore, in Calgary zone, there are 337 cases confirmed and 120 confirmed cases in Edmonton zone. The rest throughout the province, which are central, south, and north zones. Unfortunately, there were 2 deaths, one in Calgary and one in Edmonton.
Measures in place now for the situation right now for the coronavirus situation? What are the measures in place to or implemented to stop or limit the spread of the coronavirus?
So for all the residents in Alberta, and I guess that goes for everybody here in Canada, the government and the province of Alberta, they always tell us to keep updated with the news and as much as possible to keep under self-isolation for 14 days, just in case if you've been in contact with someone who had COVID-19 as well, and practice social distancing. So at least 2 meters away from others when coughing, just cough away from in your elbow area, and always keep your hands clean. So hygiene is a top priority.
Okay, so essential services, are they still ongoing? Food supply, is it ongoing? Hospitals, are they coping? Health workers?
For hospitals, for especially our frontline workers, they're definitely doing a great job, and they're spreading the message to all the residents saying that please stay at home as much as possible. They have implemented self-assessment testing that are available online for all residents and for healthcare workers as well. They are provided regarding on what kind of symptoms that you are experiencing. If it's emergency kind, it would be a 911. And unfortunately, we also have an 811 health line where you can talk to nurses regarding about the situation that you are going through. As for stocks in grocery stores, luckily stocks are being replenished in grocery stores, but they are still limited.
Are there limitations to your movement in your city's quarantine policies?
Yes, there are, especially in gatherings that are going outside. They do limit gatherings of under 15 and as much as possible less, so even just 10. And I know they are implementing a lot more laws, so people could be fined in gatherings outside in the city as well when they're not practicing social distancing.
So what conditions would give people a free pass to move around? Do you know?
What condition?
Yeah.
I would probably say, I guess like when people are driving around, because those kind of situations cannot be helped. But I know they are trying to implement something, especially for driving around the city as well.
Have curfews been implemented there too?
At the moment right now, I haven't heard. I could be wrong, but I haven't heard any from the news. They just implement not to go outside as much as possible and stay isolated at home.
So how are the people now? Are they obedient to the policies of the government?
Majority of the people are, but you do get some people here and there, which can't be helped. This is why they implement any of these rules and fines, just to get people much more safe, because this is the safety of everybody, and we're just trying to make sure that the COVID-19 does not spread throughout.
As a citizen over there, and what can you do to help in this crisis right now?
So during this crisis, it's as simple as actually just staying at home, unless like otherwise you feel like there are other health concerns. Like please like call like 811 number, talk to a nurse, ask them for advice and stuff, and stay hygiene, like wash your hands, avoid touching your face, and you can't help but you have to go outside due to necessary things. Like stay 2 meters away distance from everybody as much as possible.
All right. Thank you very much. Keep safe, as I tell everybody, and stay healthy.
All right, thank you. From Alberta, Canada, my name is Kat Joy. We live in interesting times.
Okay, so let's go over to the Netherlands. The government of the Netherlands is assuring the people that it's trying very hard to limit the economic effect brought about by the coronavirus situation. We have a report coming in, and joining us live is Malu Francisco from our EBC Netherlands Bureau. Hello, Malu.
Hi, Alma. Good evening. And here's the update from the Netherlands. The people of the Netherlands, especially in the economic sector, have one good reason to enjoy some bright moments amidst the COVID-19, because Prime Minister Mark Rutte says the government is currently finalizing the emergency economic stimulus package worth 10 to 20 billion euros. The government of the Netherlands has assured the people that it's trying very hard to limit the economic effect brought about by the COVID-19 pandemic. Well, at the same time, no surprises for the Dutch, because they have been made aware that the country is headed for a recession. Prime Minister Rutte made the announcement earlier this week following a meeting with his cabinet, and possible scenarios were discussed, and all of them predict an economic downturn varying only in degrees. And next week will be another month. On Wednesday, the 1st of April, there will be new announcements. Will some measures against COVID-19 stay beyond April 6th? Will it be a yes? Will it be a no? This is to be discussed in a cabinet meeting on Wednesday, the 1st day of April. The Dutch Prime Minister stressed that the most important priority at the moment is to ensure that the intensive care units at hospitals all over the country remain prepared and operating at capacity. Regarding the latest figures, increases and decreases, well, according to the National Institute for Public Health and the Environment, the total number of confirmed cases, 8,600 plus, and the total number of confirmed cases who are over-admitted to hospital, 2,500, and the total number of reported deaths, 546. Well, Alma, so far those are the updates, and at the moment, we're having a typical spring day, sunny, wonderful, and temperatures have risen to 14 to 16 degrees. So tempting for people to go out, take their bikes, go to forest and take a walk. But they are strongly reminded, avoid serving hefty fines, so avoid going out in groups. At least 2 at a time, maintaining the social distancing of 1.5 meters. There you go, Alma, from the Netherlands. Marilu Francisco. We live in interesting times.
Marilu, before I let you go.
Yes, go.
Yes, I don't want to let you go. But yes, I just read off an article here that you are not in a lockdown, but lockdown will depend on the people's behavior. Is this true?
Yes, exactly. And that's why they keep warning the people. Okay, it's so tempting to go out in groups and get excited, just like what happened last weekend. You know, the start of spring. And that's why the government immediately came up with measures that, okay, and one of the new measures was imposing fines on those who will not adhere to the measures introduced by the government. Avoid large gatherings. Do not go out in groups, and as much as possible, stay home.
Do you have any tips for us who are, or for those people who are in isolation right now? Oh, yes, especially for the seniors. They are the very sensitive people right now. Yes.
Yes. Here in the Netherlands, actually, visitors are not allowed anymore in homes for the elderly to protect the health of the elderly. That is one. And also, large events have been canceled.
Yes.
And one of the events actually is the opening of the Spring Garden in Europe in Keukenhof near Amsterdam. So I just thought that perhaps this is one way of of helping those who are staying home to have something to watch. Let's beat the travel ban by looking at travel memories. So here's a little production of our past coverage of the Spring Garden of Europe. And I'd like to remind you that all clips, all photos were taken in the year 2017 without COVID-19. That was the time COVID-19 free. So here it is.
Okay,
Together
let's watch
with
it.
our correspondent, Marie Francisco, we covered Cook and Hove. Enjoy.
Okay, let's watch it. Thank you, Malu Francisco from the Netherlands. As more and more of our communities lock down, you may be in more trouble with the notion of self-isolation. And if so, no better person to turn to for advice than our next person in this feature. He may be the world's isolation expert after a 20-year training and 5-month stretch of self-isolation as commander on board the International Space Station. Take a look.
Station Mir. 18 years ago, I brought a guitar up to Mir and played and sang guitar on board Space Station Mir. And so it was a real delight to have a guitar again now in orbit for the full 5 months on board the International Space Station.
Hi, I'm Chris Hadfield. I've spent a little time self-isolating on board a spaceship. How are you doing with self-isolation? You know, it's an extremely dangerous environment up on board the space station, and yet we find a way to thrive and be productive that far away from our normal life. But once you understand the risk and your mission, your sense of purpose, and your obligations, then take action. Start doing things. They don't have to be the things that you always did before. Take care of family, start a new project, learn to play guitar, study another language, read a book, write, create. So take care of yourself. Take care of your family. Take care of your friends. Take care of your spaceship.
I've been in isolation many times. I lived at the bottom of the ocean for a while on a little habitat, and I've lived in space 3 times. But my longest time away was commanding and living aboard the International Space Station. I was in space for about 5 months. I'm watching how this pandemic is influencing the group dynamic and how people are feeling. And I feel, as one of many people with a public voice, that it's important then to try and recognize that and help people recognize it also. Try and give people some tools to deal with it. To be isolated for a long time can be sort of frightening because you don't know what to expect. And whenever I'm frightened, I try and really dig into the actual risks, the actual dangers, become expert on the thing that is scaring me. And that helps me deal with my natural fear. And eventually, you are so well prepared, you've understood it so clearly, that your fear diminishes to almost nothing. In your little spaceship, your individual actions are magnified because you're a more significant part of the population. So recognizing that and seeing it and being much more cognizant of your own influence and your own impact is a key part of group psychological health. Deliberately go out of your way to do things that improve the chances of the whole crew not only succeeding, but feeling better psychologically and physically. Ease each other's burden. And then maybe the last part is be a little more self-analytical. If you notice that every other person in your expedition is behaving like a jerk, if they're all behaving like jerks, then it's probably you that's the jerk. But we also train very extensively for it. We do Arctic survival and desert survival, and we live in a habitat under the ocean, and we spend hours in very confined quarters operating complicated equipment. And we work with psychiatrists and psychologists so that we both encourage and train for good behaviors that will allow a small group of people to thrive. So your heart gets smaller and your bones degrade and your muscles waste away. So we have to exercise deliberately and hard in order to be healthy when we get back to Earth at the end of a 6-month isolation. So we have some equipment on board, but it's pretty basic stuff. We have a bicycle, a stationary bicycle with no seat, because you don't need a seat without gravity. And we have a treadmill with big elastics that hold us down so we don't float away. And we have a resistive exercise machine. But anybody, anywhere, because we have gravity, you can always lift weights. And your body is a pretty good weight. You don't have to go to a gym to stay in shape. Gyms are more social than they are anything. In any small confined space, just find a bunch of clever ways to lift your own weight. Do push-ups, do sit-ups, do jumping jacks.
And that's the news for tonight. Join us online and here again tomorrow evening. From all of us here at Eagle News, thank you. We'll see you soon. I'm Alma Angeles, and we live in interesting times.
Alamin ang tamang paraan ng pag-ubo upang mapigilan ang paglaganap ng Coronavirus Disease 2019. Ugaliing magdala ng panyo o tissue. Kung uubo o babahing, takpan ang buong ilong at bibig gamit ang panyo o tissue. Kung walang dalang panyo o tissue, maaari